What did you click? She went click, click, and now everywhere. I think I just showed my age, Dr. Yen.
That's the young people know the technology. We don't know why. I'm glad it's working. My life is the story of technical difficulty.
Oh my God, a 21-year-old walks in and all of a sudden everything is click, click, click. Okay, so I want to introduce everybody to Dr. Sophia Yen. She is the founder of Telehealth, and she is a professor at Stanford. Listen, she went everywhere, like MIT, Berkeley. She has more name brand schools and degrees behind her. And I am very proud to call her a friend because she's 1,000 times smarter than me. So she obviously fix this problem right away. So welcome. Good to see you.
Good to see you. I love seeing you and your family. It's just so lovely. I love women power, she heroes, and you and your family exemplify that.
Oh, we are women power for sure. So on Instagram, you can't see a split screen like we can here on the other formats. If you wanted to see the split screen with Dr. Yen, you can simply go to any of my Facebook pages at Dr. Wendy Walsh or at Wendy Walsh, or YouTube or Twitter, and then you see both of us. But Instagram, you can still post your questions for her. But the first question, we're talking about virtual health, okay? So I know that you were way ahead of the curve. Long before we had COVID, before we had quarantine, you were already a pioneer in the world of online healthcare giving. So I know you know a lot about it. So before we get into the nitty-gritty details, let me just ask you like a specific thing, like, what kind of medicine can you actually do online? And when do you actually need to see a provider face-to-face?
Yeah, so I think given COVID, it never hurts to call ahead, right? Particularly to see, is this something that can be handled over the phone? Is this something that can be handled over telemed? And what needs to go in? If you think you are having a heart attack or a stroke or appendicitis or anything that needs surgery, you should just go in. But if it's like a cough or a cold, certainly acne, certainly birth control, certainly menopause, a rash, you know, as long as it doesn't have a fever, vomiting, blood, diarrhea with it, then, you know, you can handle it online.
Okay, no fever, no vomiting, no blood, no diarrhea. Okay. However, you could do a virtual appointment to sort of help somebody assess whether you need to go to an emergency room, right?
You could, but if you have anything in the back of your mind involving stroke, heart attack, or appendicitis, then you just need to go because these are things that are time dependent.
Diarrhea, half of your face paralyzed, get going, fast. Timing's important. Actually, one of my listeners last week or the week before sent me a message later saying, she has a friend who I think was elderly, in her 70s anyway. I don't call that elderly anymore. And she had fallen and hurt her leg, and she kept waiting and waiting and waiting. And she's like, what should I do? And I'm like, she needs to go to an emergency. But she was afraid because of COVID and her age. Aww. She went, and then this very nice listener reported back to me that it turned out she had a fracture. And she was walking around or limping around with a fractured leg.
No, so the number one danger for older women is falls and breaking your hip. That's the number one thing. The other thing would be the wrist. And these are not things to sit at home for. And people should not be afraid of the ERs because hopefully by now they got their COVID containment down and they have everybody that's COVID in the parking lot. And that the ER should be okay. Though you might want to bring your own mask in case they don't have enough, but some places will forbid it. I don't know. And then if it were me, I'd bring a garbage bag to put over any surface that I sit on. So that way it's just me and the garbage bag.
And spray disinfectant. Honestly, I have a big spray thing of 409 right on the passenger seat of my car and some paper towels. And no matter where I go, I'm just spraying and wiping everywhere I go. That's my thing. So, we know that many healthcare providers of all different specialties are online now doing telehealth. How do you know if someone's good or not? And how do you choose someone? And also, it may be part of the same question, how does the licensure go? Like, can you see doctors in other states? I know that you run healthcare where people from all over the country can obtain birth control through Telehealth. So tell me how the rules work.
Yeah, so the rules part is complicated, horrific, and painful and doesn't make any sense because we as physicians, we take a national exam. And the way that you practice surgery, dermatology, pediatrics, birth control should not be different from New York to California to Texas to Louisiana or whatever. But because of the old systems, each physician has to be licensed in the state that they practice. And so unfortunately for Pandia Health, we can only do California, Florida, Texas, Louisiana, and we're soon going to open up Arizona, and we're going to go all 50 as soon as we raise enough money to go all 50. We currently can deliver birth control to all 50 states. So if you have a prescription in a pharmacy and during COVID, you don't want to run the pharmacy and get coughed on, or you just don't want to deal with having to worry about running out of birth control, that's just another thing to do during COVID, then you can just tell us where it's at. We move it to our partner pharmacy. We bill your insurance, ship it to your door every month, every 3 months, once a year, whatever your insurance and your prescription will allow. And set it and forget it, let Pandia worry. So we can deliver to all 50 states, but only right in the ones that we have licensed.
GYN. What about other people that might have recurring prescriptions? Can they find a doctor online, and how do you know if they're good?
Yeah, so I think it's really important as more people go to telemed. If it's your doctor, then you're fine. So for example, Stanford, UCSF, or just any your doctor, because you chose that doctor. Right. But when you're choosing a direct-to-consumer company, you need to are they somebody trustworthy? Did they go to a medical school or residency that you recognize? And do they list their physicians? I'm really shocked by how many websites don't list the first and last name of their physician or don't list any physicians. At Pandia Health, we proudly list every single person, their first and last name, all of their resume, because we're all academic and passionate.
You can full on Google them, right?
Yes,
They're there and they're real people. Exactly. So I have a personal question. I mean, I'm not trying to get free medical care on a live stream. However, I have this rash you can't see because I have so much concealer over it. And I fondly call it mask rash because I've been wearing a facial mask so much. And I noticed that my ventilator is on this side. So my breath, I think, is going up here and cause some kind of bacterial whatever. Could I go find a doctor online who could look at my pink face and be able to prescribe something?
I think that would be fine. I feel that dermatology is perfect for telemedicine. Sometimes they do need to take a sample and look if it's a fungus, and they obviously can't do that online. Our joke in medicine, and there'll probably be dermatologists are going to smack on me, is that the answer to most dermatology is either an antifungal or a steroid. And sometimes you can throw down both. The dangerous one is the antibiotic. And if it's it can absolutely be a bacterial infection because we have bacteria in our skin, and sometimes we introduce it in by scratching it. And that's why we don't recommend popping your pimples, because you can, introduce bad bacteria, flesh-eating bacteria that lives on your skin. But a rash is absolutely doable, either, with a dermatologist or just a primary care physician can look at it. If you can take off all the concealer, show it to us, give us the, story, and we look. And then if it's growing fast and quick, then you need to go to the ER and you need to get some antibiotics quick. But if it's slow and staying the same, then it's fine.
It's fine. All right. So I'm going to take a few questions from people who I know have questions about it. So if you have a question about telemedicine, how to get help, even I can always answer things like how to choose a therapist, etc. Now, you guys can actually choose, because they complain about my glasses, but I can't read the comments without glasses. So last week I had big old chunky reading glasses on, and many people hated them. So I have 3 sets of glasses tonight, and I'm going to let them choose. So all I want you to do is put a comment with either number 1, conservative, classy, elegant, number 1. Okay. Number 2, oh, bigger. Boy, my whole cheekbones are in there. Number 2. Okay. And number 3, my daughter Jones calls these my dress up and go out glasses, because they have little diamonds or sparkles at the top. Right. So just tell me if you like 1, 2, or 3, and I'll put them on and read your comments. And if you have any questions for Dr. Sophia Yen from Pandia Health, they're all telling me that my daughter deserves a raise, and that I'm very wonderful allowing my daughter to save this video screen. I knew like she would come up and just go click, click, and there would be something because they're digital natives. So 1 is winning. 1 is winning. And 3. 1 and 3. Oh,
I like 1 and 3 too. 3 has a little reflection. So that's
2 did with the
no, 3 has did. on the shiny rim. It's like blinded by the dazzle.
Okay, so 1 is winning out. All right, so now I can do, if you have, thank you all for this. I'm seeing 1, 3, not many 2s. Solange of Hollywood says number 2 has the least amount of impact. Well, thank you very much. And okay, so do we have any questions about healthcare? While I'm waiting and screening through to see about questions. Oh, why don't we put on 2 one more time because people don't like 2, so they want to see the one that's not well liked. Here it is. For some reason, it's not well liked. Okay, so I want to talk a little bit, and can I ask you, Dr. Yen, have you ever seen a therapist?
I have seen a child psychologist as a kid to be evaluated for gifted and talented stuff.
Yeah, and she said, I have a crystal ball. You are going to Stanford, MIT, Berkeley, and they'll all be fighting for you. Exactly.
Thank you. Thank you. No, I should have gone to a therapist, and I really want people to, and I know it looks bad in retrospect, but when I was in high school, I thought I was a god. And I was, the president of everything, straight A's, won this national competition, that competition. I'm going to go to any school I want. And I really wanted to go to Harvard and Stanford. And I got rejected, and I got rejected, and I got rejected, and I just wanted to die. And that would have been the time to see a therapist, because you work so hard, and then you just have your sad little high school, heart just crushed to pieces. But my message to anyone who right now has gotten their acceptances and didn't get into your first, second, or third choice is you'll be fine. That the people that are the CEOs of companies aren't necessarily the Harvards, the MIT, UCSF, or whatever. They're sometimes Santa Clara University or, something you've never heard of.
And I teach at the fabulous California State University, Channel Islands. I don't know if you saw the news today. They announced that they're the first university system to go 100% virtual in the fall. Nobody's going to school anymore. So no, it means my summer is spent talking to slides to make to create and learn more tech, but we'll figure it out. But I also can tell you that the students that I teach at Cal State Channel Islands, I've actually read about working in a state school system, and this is why it's so meaningful to me, is because this is where students move the most up socially. Right? Because as they become more, in my case, I teach health psychology, health literate, that becomes contagious with their families and in their communities. They start hanging out with peers who are healthier, who are more upwardly mobile financially. And so, in some of the, fancy schools that you went to, it's also filled with a lot of kids of privilege.
Yes.
I teach at schools where kids are literally changing things for their entire families and their entire communities and moving up. Like, I feel like it's God's work. Like,
it's amazing.
And I also want to tell everybody, I went to all 100% no-name schools. And because my whole game was, what can I take and not be bored? That's how I did my classes too. I front loaded all the fun classes. And at the end, I'm left with like law and ethics and brain physiology. And I'm like, oh no, memorizing a dictionary like you had to do in medical school. But for me, it was like I would take a semester off. I would change to a different school. I was on the 5-year BA program, and I went to 3 different universities to create that BA.
That's awesome.
There isn't one straight line, right? And exactly. I also have 2 kids. The one that hit the one button, she's in 2 weeks graduating from Harvard. So,
oh my gosh,
the one who I never.
That's every Asian's dream. You have accomplished. There's a lot of pressure on my 2 daughters.
And she, I never said, is your homework done? She got straight A+ all the way. The other one is my artist athlete who has this amazing visual intelligence, who has such kinesthetic intelligence. And we have to understand, that there are at least 8 different kinds of intelligence that have been identified so far. And we have to really honor and respect our kids and figure out who they are. Okay, I'm not seeing any healthcare commercials, but I do want to talk just a little bit about when you go online. Now, there are different ways that people can go online to find providers, right? I think if you just Google the words virtual medicine or online medicine, long before COVID, there were companies that were already setting it up. And then individual practitioners have also very quickly learned the tech and sort of hung a shingle out as well. I personally think that doing it online is sometimes better because you do have the benefit of the Google, right? You can just figure out who these people are and do some real research beforehand. Before I let you go, somebody's asking me, do I watch NASCAR? No, it's not. I'm not the demo. I'm not the demo for NASCAR. I'm sorry. Hopefully I had less student loans. Absolutely. I had 0 student loans because I paid semester by semester myself out of my pocket.
Wow.
My parents didn't pay for any school. There were no such things as school loans. I'm really old. You just worked all summer. You made enough money for at least 1 semester, if not 2. At Christmas break, you worked again and you paid. Mind you, school was $3,000 a semester, $60,000.
Yes.
So I think that makes a difference. Anyway, before I let you go, Dr. Sophia Yen of Pandia Health, do you want to talk a little bit about female reproductive health and why being able to access a healthcare provider online is important, especially to women who live in communities who may not be able to access it other ways?
Yeah. So at Pandia Health, we're really proud that we're bringing birth control to women wherever you have internet and a mailbox. And it doesn't get easier than that. And the research and our repeated efforts in advertising has shown that 60% of women, that we can increase the number of women on the birth control pill, patch, ring, if we make it easily available. And so we've seen that when we advertise free birth control delivery, 60% of the women don't have a prescription. And so by providing it wherever you have internet, all you got to do is fill out a health questionnaire, the same questions I'd ask you if you came into my office, a self-reported blood pressure, and then our doctor reviews it, makes sure it's safe, and writes a prescription. By providing that and bringing it 24/7, where in the privacy and confidentiality of wherever you may access the internet, be it at the library in the old days or on your cell phone, in the bathroom, in the car, wherever, that we are opening access to those who haven't had it before. The other thing about Pandia Health, because we're the only women-founded, women-led, doctor-led company in birth control, we are educating people about birth control. We have a YouTube, we have frequently asked questions, we do these Facebook lives and other live events, and we're trying to make birth control no longer birth control. We want to make it hormonal control. We want to educate people that you can use, if you have a uterus and you're bleeding 1 week out of 4, it is totally optional. We now have the technology to bleed every 3 months, every 6 months.
I want to address periods optional because, I'm an evolutionary psychologist and I know what our hunter-gatherer women dealt with. And they for sure weren't bleeding in the woods for a week every month. Sorry, guys, you have to listen to this part because it's very important. So here was the story of women's life. This is what is natural for our bodies. We are meant to, get periods somewhere in our teens, start having babies, and remember, there's almost a year of pregnancy. And then we nursed our babies for 2 or 3 years until they had good molars and could chomp on an animal leg. They got all their protein from mom. And so then there would be a time where maybe a year or more where somebody might search for a new partner or keep the old partner and have another baby. And so as a result, she might have a few periods in between and then be pregnant or nursing again. Now, because the infant mortality rate was so high over the course of a woman's reproductive years, her fertile years from, say, let's go with 20 to 45, she might end up in there having 5 to 6 live births, and about 2 to 3 would survive. Yeah. And that's how we are meant to live our lives until we hit menopause. And yet, because we sort of messed up the system, and now we have women gaining education during their fertility years, building their careers, having babies later. One of the reasons why we have such high rates of breast cancer in our modern culture is because the breasts are being assaulted with high amounts of estrogen every 28 days. Am I right, Dr. Sophia Yen, Stanford professor?
Yes, you are absolutely right. That is my favorite point, is we should only be having 100 periods in our lives, and we're having 350 to 400. And that increases endometrial, ovarian, and colorectal cancer. It's the number one cause of anemia in any menstruating woman, the number one cause of missed school and work in anyone under the age of 25. So if you know anybody who is bleeding 1 week out of 4, tell them to check out pendiahealth.com/. Periods optional. And on the bottom is my TEDx talk.
And 2 more quick questions from listeners or viewers here. One to me first, did they also have a lot of miscarriages back then? Yes, absolutely. It's Mother Nature's way, I'm sorry to say, of getting rid of unhealthy fetuses and not bringing them to fruition. That's just how.
That was kind of my thing, is when I was pregnant, like the month before I delivered, I'm like jumping on a bed and dancing and like, what if you lose the baby? And I was like, if I lose the baby, it wasn't meant to be. I want a strong baby. I want a baby that can survive.
Baby that can jumping jacks. Yes. All right. And another question off the topic of female reproductive health. Let's talk about COVID and airplanes. What is your opinion on flying right now?
I think that we need to get our testing down. I think that we need to make sure the masks are in place. There's a video out there showing you the stream of air as it is in the airplane. And the danger is not from the recirculation. The danger is from the stream of air. And so I read the article before I went on, and it said, normally I don't have the air blowing in my face, but you actually want the air blowing in your face so that you have blowing away from you if anybody's going to do anything. So if they cough, it doesn't come over and attack you, but it's blown away. But absolutely spacing. But in an ideal world, everyone before they got on a plane would get swabbed, and we would get a test back in 5 minutes. Who could get on the plane, who could not.
Those days are coming, aren't they?
They should be. They should be. And then the other one, at the very least, which I haven't seen, is they check everybody's temperature before they get on the plane.
The temperature doesn't tell if you're pre-symptomatic.
That's true.
Can be contagious for like 5 days.
Yes.
Before. So.
And a lot of it is pre-symptomatic, asymptomatic. I think like 30% of the infections are pre-symptomatic. So, and the other thing is you have to make sure it's a good test. It can't be a blood test because that's too late. It has to be in your nose. I've never even had a nasal swab. Tickle your brain.
I'm going to tell you something. Back in September, on Labor Day weekend, I took 2 teenage girls up to the Redwood Forest on the border of what's next, Oregon. And it was so fabulous. We were in nature. On the way back, we had a layover in San Francisco for 2 hours at the airport. Then we came back. And within 3 days, I got one of the worst flus of my life. I actually suspect, was I an early COVID person? Like, did somebody get off a plane from China somewhere back then in SFO? And so I was so sick that a week into it, I still had this fever that would come and go and come and go. So I drove myself to an emergency room at 5 a.m. It's dark, and I drive the emergency, and I go, I'm just so sick. They said, okay, well, we need to give you a flu test. Well, they try to put that 12-inch swab up into your brain. You know, they have to go to the upper reaches of your sinuses, right? Yeah. I jumped and screamed. I was such a wuss that they weren't able to get a test. They weren't able to get a swab.
Wow.
Like, let's try. And I'm like, no, I'm sorry, I'm going home. And then, a few days later, I got better. But I did have them do a strep throat test. No, nothing. So they really didn't know what it was. So I'm thinking, maybe, could I get an antibody test now?
Yes, you could. You could. The antibody test should be accurate, generally 6 to 8 weeks for sure after. And this was September, you said, right?
September. So I might, it would still show up if I had.
The antibody should be lifelong-ish, or at the very least 3 to 5 years, So
that's what I'm going to do. I'm going to book an antibody test.
Check. Because I got the antibody test because they did some random sampling to check the prevalence in the Bay Area. And I was hoping it'd be positive, but I had anything, and it was negative.
Well, I am going to let you go. Thank you so much for joining me tonight. I'm going to stay on. If you guys are here on Instagram or on Facebook or Twitter or YouTube, thank you. I have a couple more things I want to say before we go. Thank you for all those hearts flying up on Instagram. That's so sweet. But Dr. Sophia Yen, if you want to find her, if you want to get any birth control, anything to do with reproductive health, check Pandia Health, pandiahealth.com.
pandiahealth.com, and check out /periods optional if you know anybody who's bleeding 1 week out of 4. And then just as a service, we're doing a COVID blog. So I have the latest and greatest done kind of in layperson talk. The latest I put on there is if you think you want to go back to a gym or your school wants to have sports in a gym, we don't recommend it because it will just spread unless everyone's wearing a mask and everyone's been tested, blah, 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 blah. Not until the testing.
We're talking through screens, okay? When we get together for a glass of wine next, it'll be through a screen. But we should do that sometime.
It's so good to see you.
Good to see you too. Alrighty,
Thanks.
take care. Bye.
Bye.
All right, now I got to figure out how to switch this to me. I think I did it. Look at that. Okay, so does anybody have any other questions to do with anything before I ramble for a few more minutes and close off? You know that I have a radio show on KFI AM 640 Los Angeles. Many people who are watching this live stream are listeners. Thank you very much. It airs, it is live from 4 to 6 p.m. Pacific time every Sunday. You can also get it, if you miss it, anytime on the iHeartRadio app. And it is called, I think they call it Dr. Wendy Walsh on Demand on the app. And in addition, I also have a podcast, and it is called Mating Matters. There's the logo for it. So it's all about evolutionary psychology. It's all about how pretty much every human behavior that we do is linked somehow to reproductive strategy. So hello, everybody. It's so nice to see you guys up there on Instagram too. I don't know why StreamYard doesn't stream on Instagram. It does everywhere else. And since Facebook owns Instagram, I don't know. I think we need to write a letter, folks. So I want to close by, let me go back to our comments, see if we have any more. Thank you, Carol, for your compliments. Very kind of you. I want to talk about one strategy. I like to leave you with a tip and news you can use in terms of your mental health. So I've been reading a lot about dreams, and dream researchers are finding that more and more Americans, in fact, about 30% more Americans, are reporting more nightmares or just really strong emotional dreams during this time. Dreams. And so, you know, I have to remind you that Sigmund Freud called dreams preconscious material. He called it a royal road to the unconscious. So it's like when your conscious isn't ready to tolerate bad stuff, it gets filtered through your dream life in a series of symbols and metaphors and images that are really just surrogates for your feelings, right? And so, of course, so many people are feeling so much stress and anxiety during this time that their brains are really being busy working it out. Now, there's something else about the reason why I think more people are remembering their dreams. We all dream, even if you think you don't, you all dream, is that we are getting more sleep. Most people aren't setting an early morning alarm where they're woken up at the wrong stage of the sleep cycle, right? Now, why does remembering dreams even matter? Well, there's been lots of use of dreams called lucid dreaming to actually treat things like post-traumatic stress disorder, recurring nightmares, or chronic stress, and even people with bad sleep habits, right? And so what is lucid dreaming? Lucid dreaming is when you're dreaming, but you're also conscious. So you're aware that you're dreaming at the same time. And when you do lucid dreaming treatment, you actually instruct the patient to kind of manipulate the dream a bit and try to make it change the ending, if you will. And so I want to get to some of these questions in a minute. Okay, I'll get to that in just a second. If you do have questions, I will see them. And how can I interpret what dreams mean? Well, dreams mean something to everybody. So if you buy a dream book that says, if you dream about a snake, it means this. If you dream about a blow dryer, it means that. That's crazy. It has to do with your personal experience in life and what dreams mean for you. The best thing to do is to keep a dream journal and write your dreams down every morning. And you can actually instruct yourself before you go to sleep to remember it. And then start reading those journals over and over, and you will start to see the same themes and symbols crop up over and over again, just like when you read a novel. Remember in English literature, and you had to look for the themes and look for the recurring symbols? The same thing happens with your dream life. And so that's your unconscious telling you that you need to attend to this. So the other piece of lucid dreaming, okay, so how else can you create lucid dreaming? How can you be aware that you're dreaming when you're dreaming? There are two techniques that people prescribe. One is, and it's an awful one, set an alarm for 5 hours after you go to sleep. 5 hours. You're right in your deepest REM at that point, in the middle of your dream. And then what you can do is get awake and do something light, like just reading quietly for 30 minutes, and then go back to sleep. And you'll be much more aware of your dreams. And the other thing that's taught is to do reality testing more often during the day. I know this sounds creepy and weird, but literally stop, become aware and go, am I dreaming? Is this real? Like, look at your hands, feel your feet on the floor, smell things, become aware and go, no, this is not a dream, I'm real. If you do that multiple times during the day, it actually tricks your brain into doing that while you sleep because it becomes a habit. And so you can actually go into a kind of lucid observational dreaming. And then you can change your dreams. You can actually create positive endings. Okay, so some comments. Thank you very much. And not everyone is circadian rhythms. Yes, Cliff, that's a very good question. Some people, like I have one daughter who's totally a morning person, the other daughter who's totally a night person. And even when she was a baby, she was that way, had me up all night. Even to this day, she's up watching stuff all night and I can't get her up in the morning. Some people, and I noticed, I don't know the research on this, I just noticed that artists, musicians, fine artists tend to be more night people. And I think it's because they're doing their most creative work when they're closest to their unconscious, into their deep creative part. Where do you contact me if you have a great idea for Mating Matters? You can simply contact me through my website, which is drwendywalsh.com, or you can send me a message on any of my social media. We know that it's all at Dr. Wendy Walsh, but there was another question. Okay, let me read this question. See if I understand it. Amal says, I have a question. I'm a religious woman, Muslim, in my early 20s. I live in Europe, and I think I'm ready to find a guy, but I come from a strict family. My question is, what do you think I should do? Well, it really depends what you want to do. I mean, we have to remember that our family of origin and the teachings and values that they give us become a very important part of our identity. So I wouldn't suggest just rejecting everything that you've been taught. On the other hand, because you're young, I'm sure you've also been influenced by a lot of modern culture. I think I would have a conversation with your family about what they're hoping for you and whether they're going to help you choose a mate or whether this is something that you're going to do on your own. The great thing about dating apps out there is they even have Muslim dating apps, and they, go on group dates that are safe and respectful. So there are ways to do it, but I think the most important thing is you have to figure out who you are and what you want. And if your parents' consent is very, very important to you, then it's going to be a communal thing. People think like, oh, romantic love is the be all and end all. You got to go on an app and just lightning is going to strike. And let me tell you that arranged marriages have a much lower divorce rate for a couple reasons. Well, sometimes it's in cultures where you're not allowed to divorce, but also because there are 6 people minimum highly invested in that, right? 2 sets of parents and the people who are married. And so sometimes what is a relationship? It's a bridge between tribes. So sometimes having more people involved who can help you out when times get tough can be helpful. Okay, thank you for that question. That's a good one. Anybody else have any questions? Cliff says, I remember my dreams when I wake up, but I forget most of them a few hours later. Yes, unless you write down keywords. Always keep a pen and a pad right beside your bed. And before you even get up to go to the bathroom, write down some keywords so that you can continue. Remember and then build your dream portfolio and understand yourself more. Okay, let me see if there are any more that... that makes sense. All the dumb questions I just leave. Someone asked me up there on Instagram, what are the adverse effects of too much sleep? So during this time, sleeping a lot is also a symptom of depression. And so you have to be aware of whether your too much sleep is really related to, you are quite welcome, Amal, and good luck to you. And so I think you're just going to have to ask yourself whether the too much sleep is creating the lethargy and the lack of energy. And what are the mental health stuff that's going on behind the lack of sleep? Someone asked me, what does it mean if I have a dream every day and remember? I can't see the rest of it because I think it's underneath on Instagram. Let me see if I can scroll up. I'm afraid. Every day and remember. It just ends up remember. What does it mean if I have a dream every day and remember it? Well, that's good. It means you're close to your dream life, and that's wonderful. Here's a question. We're going to have a sleep show here tonight. Here's a question about insomnia. Well, there are all kinds of things that can create insomnia, of course. Mental health issues are the big one, anxiety and stress and worry. Again, what I do to help me sleep when I'm under time of stress is I, again, have that pad of paper and the pen beside my bed. And if there are things like, oh, I got to remember to do that. Oh, I got that. I write down a couple things. And then I tell myself it's there. I can leave it there now. It can leave my head. I also recommend techniques like mindful meditation, breathing work, body relaxation work. The only supplement I take for sleep is magnesium. Oh my gosh, you sleep like a baby on magnesium. And I want to remind everybody that alcohol does interfere with our sleep. The thing about alcohol is it helps you get to sleep and then it brings you up again. So you're not getting into the deepest sleep that you need. How much sleep do we need? Here's a good question. Well, here's the thing. It's largely genetic. So some families get by with, well, thank you for saying that. You don't have a question, but you literally think I'm great. Well, boy, I'm going to stay in quarantine and do this forever. It's so nice to hear that. Thank you very much. But the average human needs between 7 and 9 hours sleep a night, somewhere in there. Children need a lot. Newborn babies sleep 16 hours a day. And teenagers, because of the delay in the release of melatonin, the hormone, they actually need a lot of sleep. That's why teenagers will sleep in all day. Okay. Somebody's saying something sexy to me. I'll take it. Why not at my age? And yeah, I know there are some people who sleep. This person, the official seer, says that she has really trouble sleeping and only sleeps 4 hours a day. This is really hard on cognitive and function, immune system function. I would really say you want to work hard on sleep. Magnesium powder, yes, I mentioned it. I love magnesium. And there was something else that someone asked back here, and I was going to get to it. And it was something, a relationship question. Oh, the official seer again. Let me ask your question. I'm going to end on this because I think this is a really, really important question. And the question is for Instagram who can't see it. How do you develop a relationship with yourself? Well, we all have a relationship with ourselves. How do we develop a healthy, a good relationship with ourselves? You know, what rolls around in our head are messages from our caregivers from early in life. We may have had critical parents. We may have, like, for instance, my mother didn't mean to, but you know how every kid is like, I want the big piece. I want it. She used to always say to me, you're selfish. You're just so selfish. And so I always felt selfish. So I would give to the point of literally becoming depleted because I was giving so much. I didn't know how to take care of myself. And then but it was when I became a mother that I got to the point, and my favorite saying always is, you have to put your own oxygen mask on first before you can help somebody else. And mentally, putting your own oxygen mask on means taking the time to understand what was told to you, take some of it in, and let a lot of it go. Spend some time literally implanting your brain with positive messages. Here's the crazy thing. People think that people who love themselves or think they're so great are actually selfish people. But it's kind of the opposite. The ones who you see out there who are bragging and always saying they're so great are actually highly insecure, right? The underbelly of narcissism is a kind of self-loathing. And so people who have a lot of negative messages in their head from early in life try to compensate for that and go out and try to tell the whole world that they're great and they're wonderful. Somebody who actually loves themselves understands their strengths and understands that they're also human, and they know they have areas they need to work on, and they need to forgive themselves sometimes, and they need to get better at things. And that's what I try to do. I mean, I'm very fortunate. I think I've mentioned this before. I had a great, she's passed now, but a great mother who loved me really unconditionally, specifically in the first few years of life. She had all kinds of flaws in other ways, but I will just say she had a strong attachment to me and loved me. And as a result, sort of the message inside my brain is that I'm okay and I'm lovable. So when I make big fat mistakes, like if you were on the beginning of this live stream and saw that I couldn't figure out any of the technology and had to call my kid up and she hit one button and everything was working, I don't fall apart. I'm like, that's what happens when you're my age and you're learning it all. And I don't judge myself. I don't have these angry voices in there. I just, say, okay, there's something I got to work on. And so that's how you have a healthy relationship with yourself. You take some time to forgive yourself, to erase some of the negative messages from your early life that maybe you don't deserve. And you forgive yourself. Did I just say that? Mm-hmm. And you learn new stuff. And you give to others. At the end of the day, nobody goes on their deathbed and says, boy, I wish I'd made more money. I wish I'd worked more. At the end, it's always relationships. This is why my entire media life is about the science of relationships, because I believe that the key to our mental health and our physical health are secure bonds. And we need to care for each other. And especially during this time, we need to care for each other. And we need to care for ourselves. All right, I'm going to wrap it up. So when will you see me next? I'm going to see you all, hear you all on Sunday, right? From 4 to 6. Listen on the iHeartRadio app. Go to KFI AM 640, Dr. Wendy Walsh Show. You can listen live. Thank you so much to those who have been listening outside of Los Angeles, outside of California, outside of the country. I am just so thrilled and honored that you would take the time to listen to my shows, to read my blogs, to watch my videos online. And I really, really thank you for coming. It means a lot to me. I want you all to stay healthy during this time. Wear your masks, wash your hands, be careful. This is going to be the new way for a very long time. So let's adapt to it. Hey, I bought some lights here. That's pretty amazing. All right. Bye, everybody. I love you all. We'll see you Sunday. Bye. Now I got to end it up here. How do I do that? End broadcast.